Morning, everyone, and welcome to the webinar, Understanding the South Carolina Home Visiting Needs Assessment. I'm Caorlina Boss, the Home Visiting Systems Coordinator. We are very happy that you could join us today for this presentation. So before we get started, I just wanted to review a few housekeeping items. To start, we will be using the chat feature to ask for you to ask your questions. So as we are presenting the findings and data from the needs assessment, and if you think of questions, please just put them in the chat feature, and then we will have a dedicated Q&A session at the very end of today's presentation. Secondly, we wanted to share that the recording from this presentation will be available within 24 hours. So just be on the lookout for an email with a link to the recorded presentation, which you can feel free to share with your partners or anyone that you want to present this information to or share the findings with. So here are our presenters today. So we are happy to welcome Jonathan Arts, Program Officer with South Carolina First Steps to School Readiness, Eric Bellamy, Chief Partner Engagement Officer with Children's Trust of South Carolina, myself, Caorlina Boss, Dr. Melinda Merrill, Research Assistant Professor with the Rural and Minority Research Center, Maria McClam, the Research Associate with the Core for Applied Research and Evaluation, Kathy Ramage, the Director of Home Visiting at Children's Trust. All right, so now let's take a look at today's agenda. So to start off, we will have Jonathan Arts and Kathy Ramage providing an overview of home visiting and looking more closely at the needs assessment process. Next, Dr. Melinda Merrill will lead us in a discussion about the key findings from the home visiting needs assessment. Then Maria McClam will discuss and share the key findings from the home visiting stakeholder survey. Eric Bellamy will then discuss with us how to apply the findings of this assessment and next steps in our work. And lastly, we will wrap up with a Q&A session with our presenters. All right, so we really have three main goals for today. So one, we wanted to take the opportunity to provide background and context about the home visiting needs assessment. We really are hoping to share a lot of information and for you to find the relevancy for your work. And then thirdly, we will be exploring the implications that these findings have for home visiting in South Carolina. All right, so now I would like to welcome John Arts from South Carolina First Steps and Kathy Ramage from Children's Trust to talk about home visiting and the needs assessment process.
Hi, yes, I'm Kathy Ramage, Director of Home Visiting at Children's Trust, and I'm going to provide just a little more context on this needs assessment and how it came to be. So when Congress passed the Bipartisan Budget Act of 2018, this extended the appropriated federal funding for the Maternal, Infant, and Early Childhood Home Visiting Program nationally. MCV, as it's called, is the statewide home visiting initiative that Children's Trust administers in South Carolina. This legislation also includes a requirement for program awardees to conduct a statewide needs assessment no later than October 1st, 2020. So while the needs assessment was funded by HRSA through the MCV program, the report measures home visiting more broadly in this state and really includes key programs from diverse funding streams. The information gathered is really pertinent to all home visiting in South Carolina. So because of this, the needs assessment findings are especially applicable to driving the work of the South Carolina Home Visiting Consortium. This is a group of statewide home visiting model representatives and key home visiting essential partners such as Help Me Grow, PASOS, and 619 Office of Special Education Services, among others. This group will continue to use information in the needs assessment to inform and drive their work to coordinate, promote, and advocate for home visiting efforts that support children and families in South Carolina. To talk a little bit more about home visiting and its importance in early childhood, I'll turn it over now to another consortium partner from South Carolina First Steps to School Readiness, Jonathan Arts. But before I turn it over to him, let's play a brief video.
let's talk about home visiting and why it's an investment that just makes sense. We know that the early years of a child's development are the most critical to achieving school readiness and eventually succeeding in life. Parents are a child's first teachers, but many families face significant barriers to thriving, such as poverty or developmental delays. What if there was a way to meet these families where they are, to provide one-on-one guidance and support? Well, it exists, and it's called home visiting. Home visiting is a voluntary relationship between a family and a specialist, such as a nurse or social worker, who meets with the family where they live to provide developmental activities, health screenings, community resources, along with parenting information. It's not a one-time visit. This is about a long-term, ongoing relationship that provides a stable source of advice and support, proven to reduce the risk of child abuse and increase the odds of family well-being. Home visitors who are typically nurses, social workers, or early childhood specialists can also identify developmental delays when the chance of a successful intervention is highest. This early intervention gets a child ready to learn and succeed in school. Because when children do well in school, they do well after they graduate, which means a thriving local community. So each dollar invested in early intervention home visiting prevents dollars that would otherwise be spent in more costly interventions down the line. Home visiting just makes sense, especially when you look at the positive outcomes. Learn more about home visiting programs at schomevisiting.org.
Hi, good morning. This is John Arts from the South Carolina First Steps, and I'm standing in for Gina Beebe, who couldn't be here today. She's our parenting director, and I know that she's very passionate about home visiting as a service delivery model. So I'll try to mention all the things that I think Gina would mention and not leave anything out. That video really does sum it up nicely. And some of the key points that I would emphasize are starting early, which home visiting is a way to do that, and working with the family through various developmental milestones and stages, which home visiting as a model is also able to do through the variety of different curriculum that's delivered, parents as teachers, nurse-family partnership, and so on. And so I would just say that home visiting serves as a critical early intervention strategy to strengthen families and promote health outcomes early in a child's life and even prenatally. It helps to prevent adverse childhood experiences and sets families and children up for positive outcomes and success. Home visiting programs fit into a larger childhood system of programs and interventions and can serve as a connector for families to other supports and services that they can benefit from. And we all know, I know I'm preaching to the choir here, but we all know that starting as early as possible is important. So prenatally is as early as you can start. So that's fantastic with some home visiting models that do that. And then, for example, at First Steps, we have a Countdown to Kindergarten program that focuses on school transition. So when you're looking at the 0 to 5 age range that we're trying to serve these families and children, that's all the way right up to the summer before school. And the home visitor in that particular model is their soon-to-be kindergarten teacher. So home visiting has such a variety and richness that it can provide in the level of services and the way services are delivered. In these examples of prenatal, you have a nurse of nurse-family partnership working with the mother before the child arrives, and then you've got all the way up to school transition with Countdown to Kindergarten, working right before the child enters kindergarten. So I think it's really worth pointing out the flexibility, variety, and comprehensive nature of home visiting. We at First Steps, we really prioritize home visiting amongst our literacy and other programs. We have home visiting models delivered through our local partnerships in 44 out of our 46 counties, whether that's being delivered by the local partnerships themselves or through a partnering entity like a school district and being financially supported by First Steps. So it is definitely a priority in our organization to support home visiting. And we had an external evaluation done fairly recently that looked at not just home visiting programs, but all of our programs, which includes many of our home visiting programs. And it showed that children who receive First Step services, which includes home visiting programs, were 74% more likely to score at the highest level on the kindergarten readiness assessment and 34% less likely to be chronically absent in kindergarten than their like peers who did not receive those services. So again, I don't think I have to convince folks on this call, and we will get further information as we move forward about this needs assessment of how valuable home visiting can be. And as you can see on the current slide, it improves child well-being through the coordination and delivery of services, and it strengthens strengthening the home visiting infrastructure, the workforce, and the professional development of home visiting. It decreases risk factors and increases protective factors for families and children. So I'll stop there as sort of an intro to all the things that we will cover about the importance of home visiting in this needs assessment. And thank you for allowing me some time to talk about first steps and the home visiting service delivery model at large.
Thanks, John. Before we move into the key findings, I'll just briefly note really the folks behind this needs assessment. As the gubernatorial designated lead entity for South Carolina's MCV program, the Children's Trust of South Carolina partnered with 2 entities to complete this assessment. And those were the Rural and Minority Health Research Center and the Core for Applied Research and Evaluation, both at the Arnold School of Public Health at the University of South Carolina. So now to take you through some key findings in the needs assessment, I'll turn it over to our colleague, Dr. Melinda Merrill from the Rural and Minority Health Research Center.
Great. Thank you, Kathy and Jonathan. I appreciate that overview. And good morning, everyone. I'm really excited to be here today to represent the work of our evaluation team at the Rural Minority Health Research Center. I want to give a special thanks to Dr. Elizabeth Crouch, Jennifer Browder, and Allie Silverman from our center for their contributions to this work. Next slide, please. So before diving into the findings of this year's assessment, I wanted to provide a bit of context of the work that's been previously done in this area. We actually had the first assessment of home visiting needs in South Carolina that was completed by DHEC, the Maternal and Child Health Bureau's Title V program, on September 20th, 2010. The goal of that needs assessment was to provide decision makers with accurate information necessary for engaging in meaningful planning activities surrounding the expansion and implementation of evidence-based home visiting programs in the state. The needs assessment determined that all counties in the state had some level of need with regards to addressing prenatal, maternal, newborn, or child health, depending on the criteria used. All could be considered as at risk for poor outcomes in these areas. Ultimately, the 2010 needs assessment used a definition of risk at the county level that included both the total number of families with potential need and an assessment of disproportionate burden. As a result, 30 counties were identified in 2010 as at risk for poor prenatal, maternal, newborn, or child health outcomes, which are highlighted in yellow color in the map on this slide. Next slide. So in preparing to conduct the 2020 needs assessment, we wanted to see what had happened since that time. We'd had an infusion of funding through MCV and lots of other activity in the state. So how had that changed things since 2010? So we decided to use these 2010 data to better understand this overall growth in home visiting. Using the 2010 information as our baseline, we counted the number of home visiting sites in South Carolina by program. So since this time, we found that the number of overall sites grew 26%, which is represented by the purple line on this chart. When we looked at the sites that deploy Healthy Families America, Nurse Family Partnership, and Parents as Teachers, the 3 models that are currently supported by the state's MCV funding, we saw an increase of 65% in the number of those sites, as represented by the orange line on this chart. Given the large federal investment in MCV during this time period, this was an expected finding. Next slide. So let's dig a little deeper on how we conducted the 2020 assessment and what some of the findings were. For our discussion today, we're going to focus on only 2 sections of the overall report: the identification of communities with concentrations of defined risk factors and the assessment of the quality and capacity of home visiting services in the state. In addition, the full report also includes sections that specifically discuss the capacity for providing substance use disorder treatment and counseling services for home visiting caregivers and their children, as well as statewide coordination with other home visiting and early childhood needs assessments. I would invite all of you to review the full report if you have interest in learning more about these 2 topics. However, in the interest of time we have together today, we're going to focus on just the 2 sections listed here on the slide. It's important to note that these categories were not selected by the evaluation team. So as Kathy pointed out, this was a process that was both funded by HRSA as well as sort of created by HRSA. So we had specific prescribed methodologies that we were required to follow in conducting the assessment. So that defined our topics. In addition, it defined that our areas of need had to be identified at the county level. So one of the primary reasons why HRSA prescribed this methodology and asked us to conduct the assessment in this way is that they would then be able to compare findings across different states using similar measures. Or as we might say, they can then provide an apples to apples comparison. Next slide. So to begin, the first section of the assessment we are going to discuss is the identification of communities with concentration of defined risk factors. We conducted analyses for this section of the report in 2 phases. The first phase is represented by the measure domains you see listed on the left side of this slide. Briefly, each domain was made up of the following measures. So for socioeconomic status, we looked at measures of poverty, unemployment, high school dropout rates, and income inequality. For adverse perinatal outcomes, we looked at preterm birth and low birth weight rates. For substance use disorder, we looked at use rates of alcohol, marijuana, illicit drugs, and heroin. For crime, we assessed rates of crime using crime reports and juvenile arrests. And then for child maltreatment, we looked at child maltreatment rates. And again, all of these at the county level. So in short, we used those measures to identify which counties in South Carolina had the worst rates of these various outcomes, and then created a risk score for each county based on their rankings. This initial analysis identified 24 counties as at risk, which were generally reflective of areas in the state that are known to have consistently poor outcomes. However, we determined that this list was not inclusive of all counties at risk in South Carolina, and therefore we proceeded to the second phase of the analysis, which is represented by the measure domains you see listed on the right side of this slide. Identification of measures for the second phase were developed using a framework for target populations at risk for child abuse and/or threats to safe nurturing environments. This framework was chosen because as a state, South Carolina was found to be comparatively worse on child maltreatment occurrences and outcomes associated with these events. Specifically, in 2018, the rate of confirmed victims of child maltreatment in South Carolina was 17 per 1,000 children. And the state's ranking for this measure nationally was 43rd out of 50th on the bad side of that ranking. The second phase of the analysis ultimately led us to the full list of counties to be identified as at risk by this 2020 assessment, as you're going to see on the next slide. But I want to point out for all of you before we move on that the full report contains charts that include all of these data for each of these measures represented on this slide. So if you want to see how your county or your area of the state is doing, you can check that out there. Next slide, please. So after adding the counties that were further identified as at risk in the second phase of the analysis, we determined that 44 out of South Carolina's 46 counties were at risk due to poor prenatal, maternal, newborn, or child health outcomes. And that's represented by the map, on this map by the orange color. The only 2 counties not considered to be at risk were Chesterfield and Kershaw. So what do these findings mean? First and foremost, again, this was information that was provided to HRSA to allow them to identify and compare relative areas of need across different states. So South Carolina shows up as being pretty needy, and I think a lot of us would agree with that. Related, these findings confirm what many of us here today already know and/or experience in our day-to-day work, which is that local environments that many families experience in our state are putting them at risk for poor outcomes. And as you heard earlier in this presentation, home visiting is a primary way that we can support families in overcoming these challenges. This section of the report clearly identifies that families in the vast majority of our state may benefit from the use of home visiting services. Next slide. So following this finding, the next section of the report sought to identify the level of the quality and capacity of home visiting services in the state. In other words, how well are the current services in place able to meet the need that we just identified? With this section of the report, we specifically sought to identify the number and type of programs, as well as the numbers of individuals and families receiving home visiting services, any gaps in early childhood home visiting in the state, and finally, the extent to which home visiting programs are meeting family needs. As you can see from this slide, we focused on 7 main home visiting models for this assessment: early Head Start home-based option, Healthy Families America, Healthy Start, Nurse Family Partnership, Parents as Teachers, Parent Child Plus, and Early Steps to School Success, a Save the Children program. The reason for the intense focus on these 7 models was due to HRSA's requirements for the needs assessment, which stated that the model selected must use home visiting as their primary intervention and must use evidence-based programming. We did note in the full report that there are other programs in the state that use home visits, including, for example, DHEC's postpartum newborn visits, and as Jonathan mentioned, Countdown to Kindergarten as other examples. However, the data that you're going to see on the next few slides only uses information collected from the 7 models listed here. These data were gathered from recent evaluation reports as well as individual information provided by program staff. Next slide. So what did we find about the current quality and capacity of home visiting services in the state? First, we identified that every county in the state was served by at least 1 home visiting model with a range of 1 to 5 models present per county. Florence and Richland counties were the 2 areas in the state on the high end of that range, both with 5 models. The range of caregiver clients per county was 1 to 473, which again, the highest number was in Richland County. I'll point out that these data are available in the full report by county if you're interested in seeing, again, your specific county or area's data. Statewide, we estimated that around 3,700 caregiver clients were served annually across all 7 models. Using data from HRSA that calculated the number of families in need in each of the at-risk counties, we found that approximately 10% of those families in need were being served in South Carolina by these home visiting models. Next slide. So let's discuss this in a bit more detail. This slide and the next include maps that were not included in the full report, but I think are helpful visuals to show the data that I just talked about on the previous slide. Here we have a map that includes the estimated number of caregiver clients annually by county in South Carolina. The counties in the darker shades of orange are areas with the lowest numbers of caregiver clients. However, this tells us nothing about the potential number of caregiver clients that home visiting sites have to recruit from. In other words, we need to take the population into account to be able to use these data in a meaningful way. Next slide. So here we have attempted to do just that by calculating the proportion of existing caregiver clients by the number of eligible families by county. Specifically, the data provided here include the number of identified caregiver clients by county, which were shown on the map in the previous slide, divided by the number of Medicaid births in that county for the same time period. Medicaid births are a proxy measure used to count a likely number of families that could benefit from home visiting services. As you can see, we now have a gradient that identifies counties based on the potential proportion of home visiting needs that they are meeting. Counties that are identified as very low in the dark orange are areas of the state that may need a further look in terms of their available home visiting services. As we think about what these findings mean, I want to bring your attention to some specific areas of the state. First of all, we have a group of counties represented by a first set of red circles that showed up as high areas of need on both of these maps. The second set of counties circled in red are areas of the state where projections were used to calculate the number of clients per county due to new programs being present in those areas that had some incomplete data. So we'll need to monitor those counties closely later to see if those projections match the actual services provided. So now that I've drawn your attention to these areas, what is something that they all have in common? Well, I hope that you all see that apart from Richland County, the counties circled in red are all rural areas in South Carolina. Certainly not all of them, but these rural areas were identified as, again, high areas of need for home visiting. And this finding was substantial in terms of our overall statewide assessment. And I saw a question just pop in the chat of definition of caregiver client. What is that? So I'll answer that really quickly before I move on. That is, so essentially we counted the number of caregivers or parents as the number of clients. So we did not count children. We separated that out in this needs assessment. So hopefully that clarifies that. So next slide. Thank you. All right. So for everybody keeping score, we've talked quite a bit about the number and type of programs and families so far, but nothing yet about gaps in home visiting or the extent to which home visiting programs are meeting family needs. So as an evaluation team, these additional questions and the findings to this point, as well as the resources available within our team to collect primary data, led us to the conclusion that home visiting stakeholders in our state might benefit from learning about home visiting perspectives that were specific to South Carolina. And this went beyond the requirements laid out by HRSA. So we were able to do some different things here. So I'm now going to turn over the presentation to Maria McClam, who will share findings from the 2020 home visiting survey that she and Dr. Lauren Workman led to capture this additional context.
Thank you, Melinda, for sharing all that information. Good morning, everyone. My name is Maria McClam. I am part of the Core for Applied Research and Evaluation at USC, which is sort of a sister center to the Rural and Minority Health Research Center that Melinda works in. We collaborated with them to produce another piece of this needs assessment that is centered on providing some more context to these findings that Melinda shared. So I'm going to be walking through key findings from a statewide home visiting stakeholder survey, which was administered in conjunction with an analysis of previously conducted family interviews and focus groups. So the stakeholder survey was administered from July to August in 2020. We had 103 people respond, with the majority being home visitor administrators, followed by those who represent a state agency or organization, and then by home visitors. We also surveyed what types of home visiting models the survey participants' organization represents, with the top two being Parents as Teachers and Nurse Family Partnership. Additionally, we collected information from prior interviews and focus groups with families to understand the family perspective. These interviews and focus groups came from a compilation of previous evaluations we have done, not only with McVie, but also with DHEC's Title V Needs Assessment and the South Carolina First Steps 5-year evaluation. Survey participants indicated that the most significant barriers parents experience when accessing home visiting services were being unsure about having a home visitor come into their home, lack of awareness of home visiting services, competing family priorities, and lack of availability of services. The services and resources that were reported to be the hardest for families to access included transportation, basic needs. So these include material goods such as diapers, food, and safe housing, childcare and health care, which includes prenatal and postpartum care. These also align with some of the major unmet needs survey respondents indicated. So transportation, childcare, mental health services, job needs, and other basic needs. The most significant barriers that expectant or new parents experience when accessing community resources and services like WIC, mental health services, early intervention, were lack of transportation again, lack of availability of services, lack of awareness of available services, and competing family priorities. So as you can see, a lot of these barriers in access and unmet needs that families are having are centered around social determinants of health. If you haven't heard of social determinants of health before, it's a term to explain the conditions and then environments, the environments in which people are born, live, learn, work, play, and worship that affect their health and quality of life. So some examples of social determinants of health might include availability of resources to meet daily needs, access to services, social support, access to safe housing, social norms and attitudes, and having transportation options, which you can see is a major issue for families in South Carolina. So of all these needs, respondents indicated that there is a low community capacity to address transportation, childcare, mental health services, and job needs. As people across the state ranked their greatest barriers and needs, more items overall were identified as major problems by respondents from rural counties compared to urban. For example, parenting support and information was identified as a major problem in rural areas, but not in urban. Rural areas are also unique in identifying healthcare as being difficult for families to access, as well as competing family priorities as a significant barrier to accessing home visiting services. So in addition to asking people about the difficulties that families face, we also asked about the challenges that home visiting programs experience. Participants perceived that the most significant barriers home visiting programs face in providing services were finding referral partners, family engagement, reaching families in rural areas, and lack of family awareness for home visiting services. So half of survey respondents perceived that the need for home visiting services exceeds their home visiting program's capacity. However, many said their program does not have a waiting list. So this indicates that there could be potential issues around knowledge and awareness of home visiting services, as well as finding and reaching all families in need. A couple of participants mentioned that the eligibility for home visiting services is also limited. For example, this is a quote from one participant who explained that there is a perception that there are a lot of home visiting programs out there because the home visiting programs require prenatal enrollment or enrollment shortly after birth. There aren't as many options for families who would benefit from home visiting after children are 1 month old. So essentially, home visiting models are restrictive in who qualifies for home visiting services. Although home visiting programs face many barriers, survey participants suggested ways to improve efforts to reach families that have great needs. So these suggestions included allocating more funds for home visiting programs, promotion and education of home visiting services to families in the community, hiring qualified staff who represent minority populations or staff who are bilingual, adapting services to include options for virtual visits, promoting home visiting universal or providing universal home visiting and care coordination, using community health workers as a liaison between communities and the programs, and creating a statewide referral system. So overall, survey participants perceived that their community have low levels of infrastructure and leadership prioritization, but high levels of buy-in for implementation of home visiting programs. So many participants suggested resources, including those beyond funding, that would be needed for the expansion of home visiting programs in their community. These included local care coordination, so having available access to referrals for home visiting services, or having a no wrong door policy that would help families get what they need. Efforts to increase recognition and awareness of home visiting, workforce redevelopment and support, including salaries. Programs benefit from a robust and qualified workforce, increasing salaries and accessing affordable trainings. A range of models to meet the diverse needs of families, so having more options available to families, including different home visiting models, may help. And then again, more transportation options because transportation remains a big barrier in South Carolina. virtual home visitation options, participants suggested providing tablets or computers to families. Increased funding for home visiting programs, so having more funding will help increase program capacity. So I know we threw a lot of information at everyone, and it's a lot to digest. So to wrap it up, I'm going to go back and highlight and summarize the big picture from the needs assessment overall. So some of the successes we have had with home visiting in South Carolina are that every county in the state is served by at least one home visiting model. Home visiting programs provide a service that is much needed by South Carolina families and gives valuable information to families. Services are convenient and helpful for the whole family. We have seen that programs are flexible and it can adapt to new situations. Home visitors in South Carolina are largely representative of the populations they serve, indicating a commitment to health equity across programs. And local communities have high levels of buy-in for implementation of home visiting services. So some of the opportunities for improvement with home visiting in South Carolina include the need to reach more families. So approximately only 10% of families in need in at-risk counties were found to be receiving home visiting services. Local communities have low levels of infrastructure and leadership prioritization for home visiting programs. Additionally, families have many needs that require addressing deficiencies in the state's socioeconomic infrastructure, such as transportation, childcare, mental health services, job needs, and other services that meet basic life needs of these families. So as we think about where we need to go with home visiting services in South Carolina, we need to pay particular attention to building up access to services in rural areas. In addition, there is a need for coordination of services and referrals, as well as the need for a range of services and home visiting models to meet the unique and diverse needs of families. There is also a need to address the social determinants of health, including lack of transportation and a need to raise awareness for home visiting services among families and community partners or service providers. So now that we have given you the key findings from the needs assessment, Eric is going to talk more about next steps.
Good morning, good morning, good morning. Thank you, Maria. And thank you, Melinda, for that incredible information. So what's this all mean? Lots of great information. It's incredible information thinking about the perspectives that we received from families and service providers, incredible feedback, and just the thoughts put into it, and the process put into it. So what does this mean for you? What does it mean for your work? What does it mean for your communities moving forward? Next slide. So as you think about being leaders in your communities and within your organizations, and thinking about innovative ways to really move the path forward and looking at how we can really transition from where we are and where we've been with home visiting and early childhood initiatives to kind of a more collective and more efficient and effective space, there's ways that you can use this type of information, the needs assessment, as you think about your strategic planning on several levels, right? As you think about it on your personal level, on your programmatic level as models and innovations and interventions, even out in your organizational and community levels, your strategic planning processes can be driven by some of this work. It helps as you think about your decision makings in that work, as you build programs and as you build innovations around those programs. It helps with your collaborative spirits as well, as you connect with others in your communities at several different levels, whether it be at the micro, the macro, or the meso level. It really helps with making some of the decisions in a more collective manner and using this information. Additionally, there's some calls to actions and ways that you can use it to really, as you work within those connections and collaborations, think about how you can help present this information and be data driven. But also, as you speak with funders and legislators, think about how you kind of advocate for your programs and your initiatives and your families and your local communities. And then as you talk about capacity building, it helps you to identify needs and opportunities to really think about what are some of the things that are you're currently doing well and how this data is showing that. And then so where are some of the gaps and how do you identify and use the information to really be focused on what those gaps may be. Next slide. So as Children's Trust of South Carolina, our organization, we are the state lead in an organization that's focused on the prevention of child abuse and neglect. Our mission is to strengthen families and organizations and communities in that realm. And we want to see every child in South Carolina thrive. So how are we going to use this information? We'll give a few examples of how we plan to do it. So as we think about kind of our, in that prevention space, as we look to continue to support programs, we want to really think about how we do not sit in a direct service manner, but how we support initiatives around the state and service providers around the state. But we want to make sure that we use this information to really target what the needs are of those service providers, what's going on in the communities. As we think about some of the feedback that was given from those service providers, how can we help them build their capacities and think about how they continuously do their work and grow their work within their communities. Another thing we really want to do in that supporting program space is to really think about how we're uplifting those that are doing the work on the ground. We want to continuously tell one of the things we do through our McPhee initiatives, and we implore others to really do it as well, is how do we make sure that we let those that are doing the work know that we really appreciate their efforts. They are the closest thing to the families that they're really this information, and really that they are the force behind all this information and how they are a movement within our state and nationally. Home visiting is an initiative that has grown exponentially, and we hope to continue to support of that. And we thank those providers and those that are working on the ground. And we use this information to make sure we back up what we're saying in that realm. Additionally, as we talk about providing services, providing resources, we're not just talking about providing financial services, which we do as an intermediary agency, but we think about how we advocate for additional services, how we advocate for additional growth within the early childhood and home visiting field. We also advocate for innovative practices and promote those innovative practices on how folks can think about doing their work in a different manner, and how we can be conduits of how they're doing their work to some of the decision makers that are whether it be on the federal or on the state level, to let them know that the things that are going on in the field need to be taken into consideration with all of our decisions. So things like this needs assessment can really help drive some of that information as well. But it also gives us opportunity to seek those funding out opportunities to support the work and continue the growth within the state. One of the other things that we do at Children's Trust is we build coalitions, right? So we wanted that connectivity and that collaboration to be the true spirit of how we do our work. We know that home visiting in itself is an intervention that is based around that collaborative spirit, making sure that families are getting the needed services that are identified for them, and really building them up in a holistic manner. So as we think about our coalitions and we think about some of those decisions that are made within coalitions and those collaboratives, it helps us to really think about strategies and resources that can be identified through that process by using this data along with other data that we may have at Children's Trust to continue to build and focus on those needs. And then as we work in the training space as well, it really helps us to again target those needs for those that we support in a service provider space. But then also, as we have moved into a new strategic planning phase of the organization, we really want to be the lead in that preventative space. We want to spread the word of prevention. We want to make sure that people understand that there's a paradigm shift of making sure that we are catching families more upstream. We want to catch families more upstream to make sure they don't necessarily fall into the system. So there's those opportunities there to really use this information and to drive some of that work. Next slide. So some of the big ticket things, and these are absolutely just suggestions, but some of the things and ways that this information can be used. Examples may be, so for instance, as we mentioned a little earlier, Kathy mentioned a little earlier, that what some of the things that we look to do through the home visiting consortium of those partners that come together. We want to identify concerted planning in the workforce development area with data collection and advocacy. Another big ticket initiative in the state right now is a Thriving Families initiative that's being led by DSS in partnership with several other organizations in the state. So maybe they can use a lot of this information to inform partner engagement and strengthen the system and their systemic approach to transformation that it's really called for. And again, it's about catching those families upstream and making sure that we're being very attentive to those families that so they do not fall into services. So this information can help guide some of those decisions. Our state's birth outcomes initiative, as they work in kind of that perinatal regionalization where they want to connect local and regional initiatives, maybe can help identify some of the interventions that really can help connect some of those initiatives and really drive better birth outcomes for families and mothers and babies. And we know home visiting works, right? So how do we promote home visiting and implore birth outcomes to really look at that data and look at this data to help make some decisions around those interventions that they may be looking to support. And then entities like the Early Childhood Advisory Council, ECAC, there's opportunities to coordinate these outcomes and data with other state needs assessments and plans that are already in place, right? The PDG grant, the Birth to Five, the Title V, needs assessments. Look at that data, put it together, think about how we collectively really want to focus on and make a better early childhood system and kind of dovetail this information with some of the other things that are going on. So again, just suggestions, but other potential uses, as you think about on the local levels, think about partnership engagement, how you advocate, how you plan your work. Spoke to that a little bit earlier. It really can, help with some of those decision-making processes and to continue to improve your work. But then also as you build those local collaboratives around your programs, being able to advocate to not just those resources that are closely connected to you, but some of those funders, some of those decision makers in your communities that can really drive some of your work as well. So use this information and as some of your backing as well. As you think about finding funding, grant writing, and funding opportunities, a lot of data here that really shows not just the need in the state, but it also shows some of the good things that are happening in the state, some of the incredible work that has been done. But of course, we can always use more resources, and we want to grow a better system of home visiting early childhood. And then as you think about your communication and messaging, it allows you to help build platforms and materials for that advocacy piece. As you think about speaking to legislators, as you think about speaking to funders, as you want to build your resources in your local communities, as you want to identify and get more word out to families, there's the opportunity to use some of this information to really to drive some of that messaging and to pull from it as well within the needs assessment. So I think that's all I have. Again, a couple of quick things just to reiterate. Again, you know, as Maria said, there's opportunity here that we're seeing from this needs assessment to really build up our rural communities as we think about better coordination and service referrals in those communities or across the state. And as we advocate for kind of this holistic growth of models and a continuum of services. And then we need to make sure that we are addressing those social determinants. You know, she spoke a lot about transportation, but there's other social determinants that we really can identify and work on. And each community is different, so be sure to kind of look at the information and see what the data is showing for your communities. And then again, of course, we want to raise awareness for home visiting services for families and making sure that it's not just the awareness piece, but also making sure that you're promoting the advancement of the field, the innovation of the field, how we can think about doing things a little bit better or differently, especially as we've been through this COVID phase and how we've transitioned and pivoted over the last year or so, how we can continuously think about what are the factors that have contributed to it and using some of this data to make sure that we're driving the field into a better and more collective, efficient space. So thank you. And I'll turn it back over to Katrin, I think, who's going to guide us through any questions that we may have.
Yeah, thank you, Eric. So I would invite you all just to kind of think and reflect for a moment on all of the information shared. And, you know, just think about what information really stuck out to you the most, and what, you know, particular questions you may have, or if you just want to share, you know, a takeaway or something, you know, that really kind of was new information for you. If you don't mind, just you can unmute yourself or you can just share in the chat box, whichever you prefer. All right, so Chelsea Richard from First Step said, I understand HRSA asks for the needs assessment every 10 years. What are the plans to assess if we are meeting our family's needs as a system between now and 2030? So which one of our presenters would like to answer?
I can jump on and speak to a little bit about that. I think as we think about, again, being in more of a concerted space, especially through our consortium efforts, as we think about better collected data in a more concerted manner, as we think about making sure the workforce has some core competencies that we really want them to all address. We need to really think about how we are pulling this data together, not just disparately, but in a more concerted space. There's a lot of efforts going on through several different initiatives that are collecting early childhood data, whether it be the consortium, a lot of great things that you guys are doing over there, Chelsea, with First Steps and the early childhood systems. So how do we make that information speak better and really target the needs of the families and build initiatives through and coming together in a collaborative spirit over the next 10 years for sure.
All right, thank you. Amanda Leeson shared that what stuck out to her was that only 10% in need are actually receiving services. Yeah, I would agree. Any of our presenters want to comment on that?
Katrin, I'll just share that, you know, I think that was a conservative estimate. We tried to use, as Lindsay asked earlier about caregiver clients, we use that measure to be very conservative in our estimate. So, so it might be a little bit more, but I still think that's a really small slice of the pie in terms of really trying to identify and reach out to families that are in need across the state.
And I just wanted to also mention, and Melinda, you can correct me if I'm wrong, I think that 10% only speaks to Medicaid eligible families, not all births in South Carolina.
Actually, it's all births.
Oh, okay, all right.
Okay. Any other thoughts or any things that particularly stuck out from today's presentation? Anybody wants to comment on?
Hey, Jen, this is Chelsea Richard from First Steps. I have another question, or sort of like a plant the seed. Thinking about like that 10%, that is like, oh my God, we need to like scream that from the rooftops and like talk to legislators and everybody about like increasing investment across sort of all of our funding streams. So just thinking about the consortium and how we can really lean into that as a way to, advocate and educate legislators locally as well as federally about the importance for them, like, and need for really increased investment in home visiting. Just wanted maybe some comments on that as well.
Yeah, I'll comment on that since I'm the convener of the consortium. So this was kind of our really, this webinar today was kind of our first step in really kind of disseminating the assessments. We did a kind of a very brief overview before the full report came out with our consortium last fall, but we do have plans to really hone in on a lot of this and kind of figure out, where our advocacy efforts need to be focused on, given the data and some of, this 10%, is one of those main pieces of it that I think can really bring to the attention of legislators. And, I think that our advocacy work group really would have a lot of potential to use this in a variety of ways. And so I'm really excited to take this report, and kind of, we already are having discussions about what this is going to mean for our consortium strategically and how we're going to kind of build that into like our strategic plan with the consortium. So we'll be working on that over the coming months.
Yeah, and I'll just jump in again as well. I think that that's a great question, and that's a great seed, Chelsea, for sure. One of the things that our intention, as Kate can just mention, our intention is not for this just to be kind of a standalone presentation. We just wanted to really get this information out to make sure people knew that there's opportunity to use it, what the data says. But we want this information to bleed out, right? We wanted to make sure that using it as many avenues as we possibly can. To get the information to legislators, to funders, to decision makers to help us drive the field and drive the work. So we don't see this as we see this as more of a opportunity to build those collaboratives, to build those conversations, and to continue to reach out to folks that you may not traditionally work with to say, hey, how do we work better together? How do we build a better system? And how do we advocate together for it? Because it does none of us any good to continue to advocate in a siloed space. We really need to tell the collective story of what the need is in the state.
This is Rachel from Prisma Upstate. I think sometimes we work within our individual little departments within our larger agencies. So are there any plans to maybe present this to upper leadership at implementing agencies to gain more buy-in for the work we do?
Yeah, and I'm not going to monopolize any more speaking. I'm going to tell you that right now, right, Rachel? But thank you for the question. Yes, there are plans to we can sit as partners on several different initiatives, and we want to continue to make sure that. Ashley, could we get you on mute real quick?
My nephew is coming from Italy to go to all 4 states in June.
I think she's on the phone. Sorry. There you go. So we do plan to speak to definitely our state level as we work in those convenings and those collaborations to continue to use this information and to bring those to the table. But we implore you, Rachel, to use the information as well. As you think about bringing your leads together, bring this information to them, let them know, hey, these are some of the findings. This is what we're seeing across the state. Here's the need. And we're willing to help you, kind of bring those talking points and get that messaging out to them as well. So please reach out to us if we can help out with anything as well.
Yeah, definitely. And I'll just add, yeah, we're definitely here to help you do that. But just to kind of note as well, we have recorded this webinar. So, to what extent it can be distributed to others who missed today or to other parties, other stakeholders that might be interested in it. We're gonna be sharing that recording as well as some other resources. So just want to note that as well. But for sure, let's reach out to us, Rachel. We can help you disseminate this to some folks internally.
Okay, so there were a couple of comments that came in. So Julie said that a factor that contributes to the 10% might be that the barriers of why families are not uptaking the program. So anyone want to comment on that from our presenter panel?
Yeah, I think that's a really good point. And just to go back, some of the barriers that we talked about, transportation, like Amanda said, is a big one, but I think an actionable item is awareness of home visiting services and coordinating referral systems. So making sure that families who come into one service are being helped for the things that they need. I'm so sorry for my voice today. I've been having allergies, so I keep going in and out, but yeah.
All right, thank you. Let's see, Amanda Leeson was commenting on transportation and awareness, and those need to be addressed, and it's good to have the data to advocate. Definitely, we have a lot of potential and there's a lot of power with this data to really move this field forward.
Hey, Chair, and I will add, sorry, Kathy, to what Maria was saying about the different barriers. These data are not in the overall full report, but if anybody's interested in the by county breakdown, so the range actually for the meeting families in need was anywhere from 0.14% to 80% by county. So that's a pretty wide range. So I think that there's something there that we maybe could look at, depending on where individual groups want to dive into this a bit more, we could provide some of that additional data as well, if that's helpful.
Yeah, and if folks did want to kind of get more, county level or kind of that's very specific data, how would they go about doing that?
So most of it is in the full report. And I think y'all are going to talk about some of those resources and tools that are available. But the specific families in need versus families being served percentage by county, folks are welcome to reach out to me. I'll drop my email address in the chat box.
Awesome, thank you.
Kathy, were you going to say something?
Yeah, I was just going to comment again on one of the comments above, because I think it was a really good point to make, that it's not always to address the need doesn't mean always that we need more funding for home visiting and that's it. We need other areas to be addressed. And what I love about this data is that it speaks to that just a little bit, mentioning the feedback from families out there throughout this state. But it's, even with our federal funding at Children's Trust, we're really limited. We have been really limited. We couldn't address things like mental health, for instance, whereas there's programs out there that complement home visiting to provide mental health services for families. Well, we were told we couldn't fund things like that. So there are ways to address, your impact with your programming, that when there's barriers to do that, there's barriers overall to the success of the program. So it is more than just a simple, we just need more home visiting. It's what are the barriers to accessing home visiting and to that home visiting being successful.
Absolutely. And I'll just expound a little bit on there. I think that takes all of us doing the work as well. There's kind of a autonomy at all levels, right? That as the local service providers and funders and even as state agencies, we need to be advocating for for how we're bringing partners together, not advocating, but how we are convening partners together and using information like this to talk about what those barriers are, right? And as you do outreach in your local programs, use this information to do such things, to speak about the need to address those barriers and why families are not accessing services and how we can improve that.
So Maria commented about Kathy's point and said communities have high levels of buy-in, but low levels of infrastructure. So that's a really great point. So how do we build that infrastructure? Is the big question.
Yeah, I would add to Kathy's point that it's sometimes, it's not just about more like funding in the general sense, but that's if you're trying to address particular barriers. But I think it's the diversity in funding. They kind of go hand in hand. If you have barriers, you may need funding to address that, but it may not be in the traditional sense that it comes down. When I just think of the way that at First Steps recently, we were able to braid funding from the preschool development grant and a private foundation and Blue Cross Blue Shield to reach our Spanish speaking population that is not as well represented in home visiting clients. They're underrepresented, and through a partnership with PASOS, we're able to reach sort of a modified model, a more lighter touch home visiting, but still home visiting, not very many visits, but with the focus being to make sure that ASQ, that developmental screenings, so we don't miss children with delays, are done in a hard to reach population. And it took to kind of get it to happen. It took a partnership, a unique partnership with PASOS, two funding sources that provided enough flexibility to get it done. So it wasn't ready-made in the way that maybe traditional funding comes down to home visiting programs. So it had to be pieced together, and it might take a little more of a little bit outside the box thinking, new partnerships to make sure that if it's transportation barriers, as we do more virtual, if it's technology barriers, I'd be interested to see what funding might be around now that we've been through the pandemic and done so much virtually that wasn't around before. I know it, all this virtual home visiting that we did sort of put into high gear what parents as teachers was already doing some sort of research experimentally on virtual home visiting. And then all of a sudden it was just like, oh, well, this was a pilot thing and now it's a real thing. So it'd just be interesting to see maybe if funding becomes more flexible for home visit. Not, of course we need more, but more maybe in different ways as well.
Thank you, John. So Maria, you identified the need for a no wrong door policy of help seeking. Can you speak more about what that means and how it can benefit families and the uptake of home visiting programs?
Sure. So I think the key point is kind of coordination amongst programs. So families, if they're going into one place to get services, making sure that they're getting referred and that it's not so complicated, like standing in line for an application at one place and then having to go somewhere else. So making sure that families are getting what they need by going into whatever service or resource they're going into. And what was the other question? Yeah, I don't know if anyone else wants to add to that.
This is Debbie Robertson at First Steps, and I could add to that to kind of give an example of no wrong door on a smaller scale. But Palmetto Pre-K, which was a initiative of the Early Childhood Advisory Council, which Eric had mentioned as a place for collaboration. They now have a website and an app that's for all of the different publicly funded services for children that are 4 years old and wanting to go to childcare. So it's a collaboration of Head Start, the Department of Education, First Steps, DSS. Any publicly funded program for 4-year-olds is on this website and app, and a parent can go there and just put in their address, the age of their child, answer some few simple questions, and it determines what they are eligible for and gives them a list. And even from there, they can fill out applications for some of the programs. Others, they have to actually call. But that's the idea of no wrong door, where, I mean, the vision would be if all of our organizations could collaborate and put our programs in one place, and then parents answer some simple questions to determine like which program would be the best for them. And I believe they're doing something like that in North Carolina. They use preschool development grant funding early on to try to bring more of their state level home visiting programs together to create a continuum of services for families like that.
Yeah, thank you, Debbie, very much for your comments.
Yeah, I was just going to add as well. I think there's a lot of different things that no wrong door can mean. And I think in some places, you know, our state with home visiting is just very siloed. We have different funding streams, and they're implemented out of different types of agencies and, you know, some health departments, although, you know, some community agencies and school districts and that kind of thing. So at the local level, that can really look like just better coordination, either through a local coalition where you just get a really good way of sharing referrals based on what, you know, needs the family has. But you know, when we talk about making sure that every, say, pediatrician knows what home visiting is out there, what the differences in the programs are, and funneling people to the right program that meets their needs, that gets complicated there. And I don't think we've figured out how to solve that for the state yet. But there's lots of different ways that we can go about it. I think we've tried a couple different things and just tried to start the conversations, but simultaneously, you know, folks at the local level are doing great work in collaborating and trying to improve that type of communication and that local vision for more of like a centralized intake or coordinated, you know, referrals, so that families really at the places where they are being seeking help really connected with the service that best meets their need. And the other side of that, of course, is just making sure that we communicate and get connected to and are seen as, you know, people are aware of us in those places where they aren't yet, where families are accessing help and reaching out for services that don't know about home visiting to refer them, that kind of thing. It's a complicated question and a big one, but it's a huge need.
All right. So Rachel Hatton Moore shared that www.first5sc.org is a PDG project for publicly funded early childhood services. So that's good to know and share with the group. Check that out. And then she said her mic isn't working. But it begins development. Okay, so it's beginning development this week as a partnership with agencies in the ECAC, so that she'd love to hear from us about how we can work together on building this common eligibility portal for South Carolina families. Yeah, definitely. Please reach out to us. And Rachel, okay, yeah, so we've got your email and I'll share my email in just a second. But thank you for sharing that information. So any other last questions or comments before we move on? All right, Maggie, I think you can go to the next slide. Okay, so before we wrap up, I just wanted to share some final thoughts. So first, just to kind of reiterate, we really implore you to seek opportunities to expand discussion. So we'll be sharing this recording. Within the next week or so, we will make the needs assessment report, executive summary, and the documents related to this needs assessment available both on our website, Children's Trust, as well as schomevisiting.org. So you can take a really, a close and deeper look at the data specific for your county or your community, and really think about what that means for your work and how to incorporate it into your work. Two, and along with that, just advocating and strategically planning for expanded home visiting and early childhood initiatives in your communities. Is really important. And then three, we invite you to connect with our South Carolina Home Visiting Consortium. So as I mentioned, I am the convener of this group, and really, it's an appropriately primed vehicle for kind of moving this work forward and figuring out how to incorporate home visiting into the broader spectrum of early childhood services. So, we have a collaborative of about 30 to 40 individuals across home visiting models, various agencies and departments that are all kind of have a stake in home visiting. We meet every other month and really are just a great vehicle to kind of share information and connect the dots and try to link services together for families, with our mission being to increase access to home visiting services for caregivers and families in South Carolina. So along with kind of our larger group, we do have separate work groups that are working on kind of individual projects. So we have a data work group that's really looking to kind of gather more specific information about kind of each kind of program across the state. We have a systems building group, and then we have a workforce development group so that we can really kind of promote kind of a streamlined training opportunities for home visitors. And then we have an administration work group and advocacy. So those are also opportunities to get involved as well. So if you have an interest in that, I would definitely invite you to reach out to me and I can help get you connected to the right place. I'll just drop my email in the chat. So I would love to hear from you. And then lastly, I would just invite y'all to check out schomevisiting.org. So this is our website for our consortium, but it really just does a great job of just kind of highlighting home visiting across the state as a whole. So there's information about the various models at play in our state. We have a map where you can actually look up the individual home visiting programs by county. There's the video that we shared earlier on home visiting. If you ever wanted to, kind of pull that up and show a little bit, your partners or anyone a little bit more about home visiting. So there's just a lot of really great information on that website to help move that conversation forward. So with that, so as I mentioned, the full needs assessment report and executive summary will be up on our website within the next week or so. So please, be on the lookout for that. We'll be sharing out a link to the recording. And so you'll have the resources, you need to really continue this conversation. And before we end today's discussion, I just wanted to give a shout out and thank you real quick to our wonderful communications guru, Maggie Lynn. She's been driving this today, moving the slides forward, just kind of making sure that we have a seamless experience. She made this presentation beautiful and we would be lost without her. So we just wanted to give a shout out to Maggie and say thank you for your effort today. Any last comments or anything from the presenters before we wrap up? All right. Well, thank you all so much for joining us today. And you will be receiving more information in the recording soon. Have a great day.